And that's a great one, because I think it's a very valid concern for a lot of people. It was not helped by the fact that the whole rollout process was called Operation Warp Speed. It was pushed as being, we're doing this super fast. In fact, the messenger RNA vaccines, that's the Moderna and the Pfizer, that process of messenger RNA vaccination has been developed over about 10 years. And many vaccines have been tried to be made that way. It's just that this was the first one that really was successful. So definitely not a rushed process at all. Nothing in this world is 100% safe or 100% free of risk. And that includes any vaccine, any medication, any food. I can eat eggs. People will die from eating an egg if they have an egg allergy. These vaccines are safe. There are some risks associated, which is why each person should look at the different types of vaccines. The beauty in the US is we have a choice of vaccines. For some people, the J&J vaccine may not be appropriate. For other people, depending on the components of the vaccine, the Moderna or Pfizer vaccine may not be appropriate. There is counseling and questionnaires to answer before you get any vaccine. If somebody's really concerned, sit down and talk to your healthcare provider. They know your individual health situation. But these vaccines are safe. I have no idea how that one even started. There is zero data to support that. There isn't even anecdotal data. I mean, even during the trials of these vaccines, before they came to market, women got pregnant while they were in the trials. It does not cause infertility. There is some data to suggest that there may be some disruption of the menstrual cycle in the first couple of cycles after getting the vaccine, but even that's not completely clear yet. But it definitely 100% does not cause either male or female infertility. No, it can't. There's no DNA that's in our chromosomes. I think this is a confusion between messenger RNA, which is what the Pfizer and Moderna vaccines are, people confusing it with DNA. It does nothing to disrupt our cells. It only latches onto the COVID cell. Should it be in our system? I mean, we create the antibodies, but it is just physiologically, scientifically, totally impossible. Death is a very common side effect from COVID. Hospitalization is a very common side effect from COVID. Long COVID, which is the leftover symptoms that persist longer than 4 weeks after getting COVID, is a very real problem. And that can cause there's all sorts of neurological, respiratory, skin issues related to having had COVID that then gives you prolonged symptoms. I mean, there are people who are chronically ill from other things just because they had a mild case of COVID. Sometimes it's hard to I find it hard to wrap my head around these myths, because I don't understand why people put them out and talk about them. Because if you talk about it, if somebody goes, particularly if it's somebody with a national audience, for example, who puts something like that on the internet or on the air or in writing, of course people are going to listen. I don't blame people who believe these, who have heard these myths and have concerns. They should, hey, learn everything. But I really have a problem with people who deliberately set out to scare people and put their lives at risk. And that's what people who say that the risk of getting the vaccine is greater than that of getting the disease are doing.